I saw this quote and it got me thinking. Why do we need sleep? Well, the answer to that is, we need sleep in order to function properly. Without sleep, it interferes with our memory, performance, mood, and physical health. Studies have shown that people who get less than 8 hours of sleep have sooner deaths and severe health problems in the future. And about 30 to 40% of American adults do not obtain adequate sleep time within a year's period.
Not only in our everyday lives does sleep deprivation cause issues, it also causes some disasters in the past. For example, on March 24th, 1989, a 30,000-ton oil tanker spilt because the captain of the ship had sleep deprivation and had tipped the ship overboard. This has caused many people and ecosystems to sleep. What actually makes us sleep? Well, in our bodies, there is a chemical known as adenosine. When we are awake for longer hours, there is an increase of blood pressure and the growing urge to nod off. Adenosine is known to decrease as we sleep. The average human is known to have at least 8 hours of nocturnal sleep and 16 hours of wake time. This is known as our circadian rhythms, or biological clock. It is impacted by the changes in the external environment, so how light or dark the room is, and is also present in animals and plants. Our biological clock is controlled by a tiny bundle of cells called the suprachiasmatic nucleus, or SCN. It is located in the hypothalamus and receives light signals from the retina. The hypothalamus releases hormones and controls sleep, body temperature, hunger, thirst, moods, and sex drives. The pineal gland has melatonin, which makes a person feel tired. So melatonin usually increases in the nighttime and decreases in the daytime. Okay, so we answered the question, why do we need sleep and what makes us sleep? So how do doctors diagnose sleep issues? So it occurs when the person is unconscious, and sleep specialists record sleep using a polysomnogram, or PSG for short, which measures brain activity, eye movement, muscle activity, heart rate, and rhythm of blood pressure. So how much air is being inhaled and exhaled. Non-REM sleep, which is stage 1, when your eyes are closed, but it's easy to wake. Stage 2 is light sleep, but your heart rate slows down, and so does your body temperature. Stage 3 is the deep sleep stage, and stage 4 is REM sleep. In 2007, the National Sleep Foundation had performed a study to see what would happen if rats were denied sleep. The results caused them to be sleepy and tried to survive without food and water, which caused an earlier death. In another instance, a sleep-deprived mother had left her 6-month-old baby in the car for more than 8 hours, instead of dropping the child off at daycare. Sleep deprivation also has negative effects on our immune system. Our insulin increases and weight gain, and it is a higher risk of diabetes, obesity, cancer, and heart disease. Harmful disorders are insomnia, sleep apnea, and many more, which are caused by not enough sleep. So what is insomnia? In Latin, it basically means no sleep. The word in means without, and somnus means sleep. Insomnia is the difficulty to fall asleep or waking up too early. The causes still remain unclear, but many researchers believe that they are caused by psychological problems, medical disorders, physical conditions, substance exposure, unhealthy sleep habits, or biological factors. There are 2 types of insomnia. There's primary insomnia, which are sleep problems that are not directly associated with health conditions, more so up-putting thoughts or experiences. This is also known as acute insomnia, so it occurs one night to a few weeks. Secondary insomnia are sleep problems that are because of health conditions such as asthma, arthritis, or cancer. It could also be the cause of many pain medications or substances. This is known as chronic insomnia, which happens 3 nights a week or for a month or longer. Many different causes that makes it difficult for a person to sleep, such as nasal sinus allergies, reflux, endocrine problems, Parkinson's disease, chronic pain, food or eating habits, lower back pain, and high or low blood pressure. Insomnia can affect a person's whole life. It can affect their personality and performance, causing a lack of energy or concentration. It can also affect their health with tiredness or fatigue, and stomach burns and hallucinations. This can also disturb many people with their workplace habits, school place habits, and relationships as well. For diagnosing insomnia, doctors might suggest a person to go to a sleep center for special tests.
Created using Powtoon.